Hi everyone, we are Group 8 and our presentation will focus on safely managing pain through the use of cannabidiol products, otherwise known as CBD. So what are opioids? Opioids are a class of drugs that include the legal drug heroin, synthetic opioids such as fentanyl, and pain relievers available legally by prescriptions such as oxycodone, hydrocodone, codeine, morphine, and many others. Some disadvantages of prescription opioids includes the fact that they're expensive, highly addictive, there are harmful side effects, can cause the high effect, and they interfere with memory when taking pills. What is CBD oil? Cannabidiol is extracted from the flowers and buds of marijuana or hemp plants. It does not produce intoxication. Marijuana's high is caused by the chemical THC.
The benefits of CBD include and are not limited to the following. CBD products are less expensive, easier to access, are non-addictive, have fewer side effects, there is no high, and there are more options in their products. According to McGuire's inputs, our source population is full-time public health female students ages 20 to 22. The message we want to convey is to ask a physician about CBD products as a means of harm reduction. This will lower our risk of getting addicted to highly addictive opioids. The two channels we will be using in our video is through Facebook and flyers that we will supply to doctors' offices. The receiver will be male and female San Diegans ages 55 to 70 taking opioids for pain management as their primary audience. As our secondary audience, family and friends of those taking opioids. Finally, our destination is to prevent opioid addiction.
Our primary audience is elderly San Diegans between 55 and 70 years old who manage their pain with doctor-prescribed opioids. Our secondary audience is family members and friends of our primary audience. Because our target population is reaching a vulnerable age, they are experiencing frequent injuries and pain. Doctors typically provide patients with one main option for pain management: prescription pills. Thus, older adults are at a higher risk of becoming addicted or accidentally overdosing.
For our primary audience, we have the persona Jane. She's 68 years old, retired, married, insured by Medicare, and lives in Temecula in a house with her husband. Recently, she began to take hydrocodone, which was prescribed by her doctor to manage chronic back pain. She's hesitant about continuing her prescription because of her harmful side effects she has experienced: mood changes, nausea, and drowsiness. For our secondary audience, we have the persona Frankie. He is 20 years old, single, works at Jamba Juice, and is a nutrition major at SDSU. He lives with his grandmother Mary in a rented house in Chula Vista. Mary has been taking prescription opioids for 5 months to manage her pain after hip surgery, covered by Medicare. Frankie has been noticing signs of addiction, drowsiness, confusion, and increased dosage, and suspects Mary may be abusing her pain medication.
Our target behavior is substituting prescription painkillers with CBD products because it is much safer. Many people have overdosed from misusing prescription opioids, so it is very important to make a change to using CBD products. Some examples of CBD products include creams, oils, and edibles. Even though these products are natural, we do recommend that you first speak to a doctor before making the switch.
To be able to attract our targeted audience, we will be using Facebook as our primary platform because it is one of the most common sites used among middle-aged adults. On our Facebook page, we will include information about the benefits of CBD oil and how it is a great alternative to modern medicine without the side effects of marijuana. Another way we could appeal to our targeted audience is by creating flyers to bring awareness on the health benefits of CBD. We could post flyers around doctors' offices and pharmacies.
For our first message, we want to make the switch from highly addictive opioid painkillers to CBD through our emotional heat appeal. Even patients who only take their recommended and prescribed dose can fall victim to opioid addiction. There are alternatives to a temporary pain injury that a person can use as to not become dangerously addicted. There are harm reduction outlets for people struggling with addiction, such as CBD. Quitting cold turkey may not be a realistic solution for most of the population. We will be using a loss framed here. If you do not use CBD and continue to use opioids, you are likely to become addicted and suffer further issues. For our ELM model, we are using the central route, which is sharing a video of an elderly woman throwing away her opioid pill bottle and using a CBD product instead. This can be thought of as a logical choice to switch to CBD versus the detrimental effects of opioid painkillers.
Our second message is that CBD helps relieve pain without the effects of getting high. We use a light, logical appeal as a call to action to stop using prescription opioids now and start managing your pain with CBD instead. Taking opioids at too high of a dose or for too long of a period of time increases the risk of addiction, overdose, and death. The likelihood of using opioid painkillers long-term spikes just after 5 days of use. 5. And because of this, a lot of people are dying. So go to your local dispensary and purchase a CBD product and talk with your physician or doctor about it. We use a gain frame to say that CBD relieves pain while allowing normal daily activities to resume without the side effects of getting people high. For our second theory, we will use the elaboration likelihood model with a peripheral approach. We will post flyers in doctors' offices and pharmacies to inform people of how CBD is a safer choice for pain relief, as well as post a video on Facebook of an elderly woman throwing away her bottle of prescription opioids and using a CBD product instead. Almost all seniors have experienced some sort of pain in their later years, and medical marijuana can help with that. It can help relieve pain from joint pain, like arthritis, nerve damage, and chronic illness like cancer.
This is the flyer we will use.
Oh my god! It says here that opioid overdoses were involved in more than 3,300 deaths in 2015, and that CBD is a better option. Oh, Grandma, don't take your opioids. Oh no, those are insane. I have CBD. Alright, I'll throw these away.
These are the 4 A's of messages. For announce, we will provide coupons for sponsored dispensary that offers CBD discounts. To advise, we will inform audience about the risks of taking prescribed opioids and the benefits of substituting CBD. To activate, we will ensure knowledge that opioid painkillers can be highly addictive. CBD products are a safe alternative to manage pain. To advocate, we will promote the overall public health benefit of harm reduction methods for opioid dependence.
Our SMART goals consist of a process goal, output goal, and an input goal. Our process goal is to increase reach in elderly San Diegans ages 55 to 70 years old by 10%. Our output goal is for 30% of patients in San Diego ages 55 to 70 years old to have discontinued prescription opioid use 1 year post-intervention. And lastly, our input goal is for 5% of patients in San Diego ages 55 to 70 years old will be interested in switching to CBD products post-intervention.
CBD for me!